Welcome to Long-Term Care Policy and Management. This is Public Health 627. This is your Week 3 video. This week we talk about rehabilitation services and skilled nursing. What is rehabilitation and skilled nursing, and who are these patients? We cover some basics of rehabilitation care, regulations and costs, and resident rights. So the first question really is, what is a skilled nursing facility? The simplest definition of a skilled nursing facility is a Medicare certified facility. So a lot of students say they're confused by that. What it means is, the reality is a skilled nursing facility looks like everything else, but it's certified by Medicare to be a skilled facility. Skilled nursing facilities provide non-custodial care, which means care for consumers that won't be living there. They can look a lot like a nursing home or a hospital, so you could be in a skilled nursing facility and not be able to visually tell that it's any different. The difference is really the services that are covered and not the physical building. The book uses post-acute and subacute terminology in this chapter. I think of post-acute as the broader term, encompassing everything that follows the hospital visit. So some people will use skilled nursing under the umbrella term of post-acute care, and some people will use it under the term of subacute care, which you can really think of subacute care as care that's beneath what a hospital would provide, but probably above a nursing home. So really, what's the difference between a skilled nursing home and a nursing home? Well, the differences are not visual. So if you walk into a skilled nursing home, again, you're not going to see a difference. The difference is the payment sources, the staffing, and probably the patient population. Medicare Part A covers skilled nursing care in a skilled nursing facility. What Medicare Part A provides is a semi-private room, so a room that you would share, meals, skilled nursing care, PT and OT, speech and language services, social services, medications, medical supplies and equipment in the facility, ambulance, transportation, and dietary. And I'm just going to throw out a caveat here. There's no real good place to put this. So a skilled nursing facility could be in a nursing home or in its own skilled nursing unit. The book talks about how there are some skilled units in hospitals now. There is also this caveat where there's basically what's called a swing bed. If you're a critical access hospital, so the small hospitals really out in the rural areas, they can make an agreement to have a swing bed. A swing bed is basically when you have a hospital bed that you can turn into a skilled nursing facility bed as you need it. And this was done because in rural areas, it just makes it easier. If you're in a big urban area, you really can't do that. So this is kind of confusing, but you probably will hear the terminology swing bed, so I just wanted to tell you what it is. A swing bed is basically a hospital bed that can turn into a skilled nursing bed, but it's not in the big hospitals, it's in the small hospitals. So Medicare covers skilled nursing. Both Medicare Part A and Advantage plans, which are under Part C, have different rules, but Medicare sets the minimum. Medicare Part A and Part C Advantage plans cover hospital care and skilled nursing facility care. Nursing home care is not custodial care. So sometimes it covers basically a nursing home as long as you're getting skilled services and you don't live there. It covers hospital and home health services. So Medicare is made up of Part A, Part B, Part C, Part D. Medicare Part A, just the basic Medicare, covers skilled nursing. If you opt out of Medicare Part A and B and get your own private Advantage plan, which is called Part C, the Advantage plans really have to match the basic Medicare offerings. So I'm sorry if I'm being a little confusing, but Medicare is really difficult to explain. Medicare Part A and Medicare Part C both cover skilled nursing. It's because Medicare Part C mimics Medicare Part A. So I hope that makes sense. How much does skilled nursing cost? Well, since Medicare usually covers skilled nursing care, the prices usually are the same everywhere. Days 1 through 20 in a skilled medical nursing home stay is $0. So if you have Medicare Part A or you have an Advantage plan under Part C, days 1 through 20 in a skilled nursing home are $0. Days 21 through 100, there's $167 coinsurance per each day. A lot of people don't know this and get really stressed out when they get this huge bill when they've been in a skilled nursing home for a long time. They probably were told when they came in that Medicare covers all of it. Well, it does up until day 21. Days 101 and beyond in 1 year, the consumer pays all costs. So if you need skilled nursing home, days 1 through 20, if you were there for that long, would be $0 under Medicare. Days 21 through 100, there's $167 coinsurance per each day. And then after day 100, the consumer is basically on the hook for all the costs. Now, there's a caveat here that I just want to give to you. There are some states that use their Medicaid programs to pay skilled care under very limited and certain situations. I don't want you to get confused about that because I know skilled care is paid for by Medicare. Just know that there are some very unusual situations where Medicaid can pay. But that's not the general rule whatsoever. Medicaid will sometimes also cover those days 21 through 100 when you have the $167 coinsurance. It's confusing, I know. But say a consumer qualifies for Medicare, went to the skilled nursing facility with a broken hip. Days 1 through 20 were covered by Medicare. Say this consumer needs to stay for another 20 days, but the consumer really has zero money. Maybe they live on $1,000 in Social Security a month. Medicaid sometimes in some states will cover that coinsurance as long as the state covers people who don't make enough money. So that's my little... Who's covered for skilled care? Well, Medicare consumers are covered if they meet certain conditions. You have to have Part A and have days in your benefit period, or you have one of those Part C plans. You have to have a qualifying hospital stay, which is usually 3 inpatient days. So a lot of times people are confused because if they went to the hospital and they probably need skilled care, but they were only in the hospital 2 days, they're told that Medicare will not cover skilled care. And it's because one of the basic requirements is you have 3 inpatient days in the hospital. Inpatient does not include an emergency room stay. So assignment 1 is coming right up. This is just your proposal for the long-term care policy. It's worth about 5% of the overall grade. This might change throughout the semester, and that's fine. You should really just start working on a thesis statement that will guide you. The discussion forums really have attempted to help you think about what you want to talk more about in long-term care. So a lot of you who found there's certain things like one of the 6 criteria that you were attracted to, that's where you would really start. So just choose a topic, discuss why you chose it. Your response should be about 200 words or fewer, which is 1 page. This is really just a way, this assignment is just a way for you to start this long process. Don't forget the exploratory readings this week. They cover a lot of skilled nursing care if you're still confused. As always, feel free to reach out, email, phone, text. Skilled nursing care is a confusing topic. And as always, I'm here for your questions, comments, or concerns. Good luck with week 3.